Reconstructive foot and ankle surgery is a really broad topic, so it's kind of a tough topic to talk about. I think the more common things on that end of the spectrum are things like pes cavus or high arch feet, or pes planus or flat feet. The other end of the spectrum is more congenital deformities like clubfoot that hasn't been corrected when people are children, or limb length discrepancies where one leg's shorter than the other. Also, that kind of falls into that is Charcot reconstruction. In diabetics, they can develop a rocker bottom foot, and sometimes we do surgery to correct that so they don't develop ulcerations and infections. No one was really doing reconstructive surgery before. That's part of the reason they brought me in. I have specialized training and the ability to address some of these more complex things. Typical podiatry, especially in the past, was more bunions, hammer toes. They call it the bread and butter, and this is a little bit more complex and unique. Any kind of reconstructive surgery is a big thing to undergo as a patient. I think what sometimes gets overlooked is all the options for conservative care before jumping onto a big reconstruction. It's a lot to think about for a patient and a family. With foot surgery, it's being non-weight bearing on that foot for 6 to 8 weeks most of the time while the bone heals, and they need good family home support to help them shower, cook, do just normal days of living. Common questions are most of the time kind of the healing process. I'd say that's the most common question. How long is it going to take? How long am I going to be off of my foot? What does this look like? It varies from case to case and depending on the procedure. What I always tell people is that if for anyone, no matter what age, it's 6 to 8 weeks for bone to heal. So we're looking at that as a minimum, and it can take longer. It can be up to a year before it's back to 100%. The benefit of correcting these kind of severe problems is really a change in quality of life. A lot of times when it's these severe problems, people aren't doing the activities they want. Even something as simple as going shopping and being up on their feet can become difficult to do, or going on a walk with their family. It's the little things.